Hello and welcome to Community Matters, a podcast from the Canadian Association of Community Health Centres. I'm your host, Hilary LeBlanc. On this episode of the podcast, I'm speaking with Hayden McGuire, Executive Director at Switch, the Student Wellness Initiative towards Community Health Centre in Saskatoon, Saskatchewan. Switch Community Health Centre augments the training of future professionals while improving the health, education, and skills of people from Saskatoon's core communities, ultimately achieving lasting positive change for everyone involved. How are you doing today, Hayden?
I'm well. How are you?
Great. Thank you so much. To start off, I would love it if you could tell us a bit more about Switch, where your organization is located, the services and programs provided, and the communities and population that you serve.
Sure. So we sort of very carefully say that we're the longest continuously running student-led or student-run clinic in Canada. We're turning 17 this October, which is always exciting. We are located in one of the core neighborhoods in Saskatoon. We're located within the Westside Community Clinic, which is another community health center. And we are fully student-led. So we have student board, student volunteers running our shifts. We have a very small staff, which I'm one. But otherwise, pretty much everyone here who is making Switch happen is a student. And what we're doing is way back in 2005, so those 17 years ago, a group of medical students as well as other health science students decided that they could see a gap in the health services that were being provided to the core, which is where we're located. And they started to try and step in to sort of build some programming to fill that gap. So our programming is hugely diverse for what we do. Every single shift, which is usually about 2 hours, includes a meal service. It includes programming, educational programming of some kind. It includes the ability to visit with a primary health provider or some kind of counseling if that's what you need. And generally it included childcare. I say included because that was a pre-pandemic format, and we're hoping to get back to that as soon as possible. But right now we've had, of course, as everyone did, that reduction of services, and we're still working to rebuild them. But I think that's the sort of long answer about who we are and where we're at.
No, that's amazing. And we will be getting to the pandemic shortly. But before we do, as you mentioned, being a student-led community health center, you're one of a small number across Canada. And there are examples of this approach delivering community health center services in the United States, some other parts of the world. What would you say are the core advantages and benefits of having a student-led community health center?
Sure. I think we provide a unique opportunity. So in Saskatchewan, there is us and the Search Clinic in Regina. And we allow students to come in and engage in clinical practice and engage with the communities that we serve before they would have that opportunity otherwise. So that means they're able to sort of facilitate their learning with actual practice, and they're able to see circumstances and learn about how what they're going to be doing is applied before they would before, and maybe learn things that change how they practice. I think the other thing, so from the community side, we are able to offer like that wide variety of services, and we've been able to shift what services we provide relatively quickly because we're quite small and because we're volunteer run. So for example, we've run a tax clinic, and at this point, I think we're one of very few, if not the only volunteer tax clinics that are still up and running at this time. So folks who haven't completed their tax return know they can come to us and get the support for that tax return for free. And that's partly just because when we were operating, we saw that need and we were able to step in pretty quickly. So that fast ability to respond to community need is something I hope that we're also able to sort of turn around for the community.
That's amazing. So getting more into the nitty-gritty of our conversation, which is going to be centered around the COVID-19 pandemic. Over the last 2 years now plus of the COVID-19 pandemic, it has presented unforeseen challenges in all sectors, and the vulnerable population has been one of the hardest hit groups. What has been the impact of the COVID-19 pandemic in your specific community, and how have you been able to address it? And how has your organization navigated providing that care and services during this difficult time?
Sure. So Switch, our mandate is to serve Saskatoon as a whole. But our location in the core community does mean that we see, folks who are struggling with housing security, with food security, who may not be able to get sort of care that they need otherwise. During the pandemic, we saw a lot of the student-run and student-led clinics ended up having to shut their doors just because their resources were not available. And a choice was made here to really fight to keep a minimum of services. So I think the lowest service level we went down to was still having that access to our clinical services, including our counseling services, and still having food available for folks. The format of that changed quite a lot. So we used to have this wonderful space where folks could come in and actually be in community with our volunteers and sit down and have a meal and have a chat. And we've pivoted to a takeaway service, and that's still what we're doing. So we still I really do look forward to the day when maybe that can change and we can fully open the doors. But of course, we want everybody to be safe and protected before that's something that we're trying. But that shift in how we access community, how community accesses us was really, I think, one of the hardest things to see during the pandemic.
Of course, absolutely. Your community health center is one of the recipients of the CVP-National PHAC funded project on behalf through us. Could you tell us a bit more about the project and the goal that you had, including telling us any of the activities or programs that you were able to carry out or resources that were created?
Sure. So we really consider ourselves a holistic clinic, and we hope that that's sort of visible through the services we provide. But one of the sort of areas of health that I think is under considered still is that folks that we serve have another community or another group of constituents of our community, which is pets, right? So when we sort of started talking about, there are community pets out there that we don't see and that we don't know about, we sort of had a surprise response like, oh, not nobody, but there are folks who really hadn't considered, there are people whose pets are not being cared for. And I think that kind of pet care is it sits in this complicated space, right? Pet care is actually private in Canada, but there's all kinds of studies and information out there that say when your pet is receiving appropriate care, it changes your whole household's health, right? It's the classic, the cat is showing symptoms of emphysema, so the person finally can stop smoking. That's been found to be true in surveys. So we sort of started with that idea. What can we do? And fortunately, there's an organization locally, I think it's the local chapter of a national organization called Community Veterinary Outreach. The Saskatoon one is the branch that we work with. And they had sort of started to land here and look at how they were going to set up their care. And we said, well, can we partner with you? Can we really make that event? And so we started looking at having, our first event was a pet fair. And then our final event was actually a clinic where the vets were able to receive health care from CVO, from the veterinary outreach. And both times we said, well, let's come along and let's bring human vaccines, right? Because then all of a sudden you're having that conversation in a different context about, well, of course you're going to get your dog vaccinated. And of course you want the same care for yourself. So we had this idea that would maybe shift the conversation, shift the context a little bit, and let people reconsider where they were sitting with respect to vaccines. So those were two. And then we were also happily able to provide a community barbecue, which was just, so we've really focused on the community event aspect of sort of these, the funding, so that we were able to provide places where people wanted to show up, first of all, and then we would sneak in some conversation about vaccines and make vaccines available to them when they were there.
No, that's amazing. We've had a couple of other CHCs who have done some of that like sneaky work, as you just said, and it seems to work really well. But this was obviously the first I had heard throughout the pandemic of something involving pets, and I think it's wonderful. Living in the Greater Toronto area, we see a lot of precariously housed people who still have pets. Pets bring people joy, their love, their care, their support. There's something to give your attention towards, and you're completely right that if you're getting your pets vaccinated and you care about them, hopefully you're going to start looking inward at the person who has to care for that pet and making sure that your health is at the utmost standard as well. So I think absolute like such cool innovation and a very cool project. What milestones or achievements were you able to achieve, or lessons learned by doing this project and this community outreach?
Sure. So the vast majority of the time we ran out of vaccine at our clinic, which was super exciting. I think the first event that we held, we didn't know what to expect. But we've been fortunate to work with vaccinators from the Saskatchewan Health Authority, which is the health authority in charge of just everything in our province related to health. And they had said like this was good turnout. So for us, part of all was learning, what does good turnout look like in an event like this? So what are the things that you expect? I think another big learning for us was, you have to, if you're a trusted agency, or if that's your understanding, you have to put yourself out there. You have to put your name out there, because you really are trying to provide reliable, safe service, but you're trying to provide it in a way where the folks who are coming in know that it's you. They know. So we have established relationships. We have folks who show up regularly for, whether that be our meal service or our programming. And if they knew it was us, that changes the game. They both are able to maybe have a little bit of trust in what they're coming into. But I think even more so, they're able to understand, this is free and this is for you specifically. You're not being sort of closed out. It's not something that's for other folks. It's for everyone, and it's especially for you. So come on in and see if there's anything that you can benefit from today.
Amazing. On the flip side, though, were there any specific challenges or barriers, in regards to vaccine promotion and uptake in your community? And how were you able to manage these challenges alongside with doing all of this great outreach?
Sure. I think we do have a community that does have distrust, sort of overarchingly, at least to some extent, in some of the institutions. So we have some folks who really don't necessarily want to engage. I think one of the staff here at Switch pointed out that the fact that we're volunteer led. So although we have folks who are going to be health science professionals, they are not yet health science professionals. They're the kid who's still learning, and that's the attitude they end up showing up with, and it makes it sort of actually safer when it's someone who's more in community, who's able to be more in community, who isn't yet that professional with the white coat or the scrubs, but it's the kid who served you dinner last week. Sometimes that makes it a safer way to access that. But I think the challenges are sort of ongoing. How do we build trust? How do we make folks understand, or ask them to understand that we really think that this is for their benefit, and that it's going to be protective and supportive of their well-being?
That makes a lot of sense from a lot of what I've heard from other CHCs as well, that it's someone who seems more like they represent you and you're seeing yourself in some of them. And sometimes these authoritative figures feel much more closed off. And so I can completely understand where they're coming from in terms of other conversations where Black communities want Black doctors. And so it makes a lot of sense that person who fed you lunch hopefully isn't going to steer you wrong when it comes to your health. And so that completely makes sense from the mindset of those people. You mentioned briefly partnering with the CVO and the Saskatchewan Health Authority. I was just wondering if you wanted to elaborate more on what those relationships did and how you were able to leverage and ensure the delivery of your project with those two partners, and any other partners if there were.
Sure. So to me, those were the two bigger ones from what we needed to do. The health authority, like I said, is always really generous. So we had events on the weekend, and they made sure those were appropriately staffed so that people who needed to be doing the vaccines could come in and actually be doing that on site. Sometimes that meant some requests. So we had a generator going for their laptop at the barbecue because everything was outside. So just to make sure that they were fully functional. But they've been really, really generous with their time in making sure that every time we sort of went out in community, they were following us with vaccines or they were bringing the vaccines along. CVO, I think, is an ongoing, I hope is an ongoing partnership. We've been really fortunate with them. So the Western College of Veterinary Medicine and Royal Canin have worked together to provide us dog food, as well as cat food regularly at the clinic. So we sort of have that in with that way. We always try and sort of have multiple ways of talking to someone about what their needs are. And so we usually have pet food on site just for folks who need it. They can stop by and top up to make sure. And so we have that ongoing relationship with them about who their pets are and what their needs are. But CVO, I think, is bringing, like I said, that really neat service of they allow access to care for pets in the community who might not otherwise have access to veterinary care, which I think is wonderful.
Yeah, that's amazing. So obviously the pandemic continues to sort of shapeshift and change around us with new variants, the approval of booster doses. What effect have these changes had on the work that Switch is able to carry out with the CVP-National project, and how else have you been adapting to this ongoing public health issue?
Sure. So I think, to be frank, we really just looked for folks who needed a vaccine. We didn't worry, is it your first dose? Is it your second dose? We said, do you need a vaccine? Then come on in. And I think we're starting to see some statistics that are saying like that's starting to equalize a little bit. And I think the boosters are sort of the new challenge, but I think that's something where we're gonna refocus and come back with what are our strategies if we're focusing on boosters. But honestly, up to this point, we've just tried to get people in the door. Our focus has been, if you're not fully vaccinated, come on in.
Of course, that definitely priority number one is at least a first dose. That's what we're all, I think, hoping
Yeah.
for. How's the funding of the CVP-National project helped your center outside of just these programs and the community it serves, if it has?
Sure. So the funding allowed us to sort of step into being in the community again. So we, with the pandemic, like literally the doors are a little bit more closed than they have been in the past. And of course, like again, that's for safety, that's for community member safety as much as anything. But the barbecue and the pet fairs really allowed us to be in community, which for me is one of my favorite things about being at Switch, is that you're with community. You're, serving the hot dogs and then watching the kids play the games that we set up for them, right? Like I think that's the passion of this work, is actually building community and being part of it. And so that funding allowed us both to step into community again and also to have a purpose, to have a reason to say, come to the barbecue and learn about your vaccination and see if that's what you need today. Come get your pet care, and same thing. Do you need a vaccination as well? Do you want to talk about your health and your pet's health? So it really allowed us to start rebuilding our community a little bit and to be present with it.
Of course, which is so important. You mentioned briefly, obviously, sort of regrouping and starting to focus on boosters after getting at least some first doses out, not being too particular. But what are some of the next steps for your center after the CVP project with regards to COVID-19, if there were any other plans, and your hope for the future, other than hoping that the pandemic comes to an end, I'm sure, as we all hope.
So I'm hoping that Switch is able to Switch and Westside, I think both are able to stay as that trusted source of information and the place where you can come to talk COVID vaccines and possibly get one when they're available. Like I said, I think that rebuilding of community to sort of facilitate that is going to be the bigger thing. So when we're in community, then those conversations happen really organically, they happen naturally. And it means that we can just one of my favorite words with respect to vaccination is just opportunistic. We can opportunistically support people with getting vaccines because they're here anyway, and because we're already in conversation.
Of course. What do you think your experiences throughout the pandemic say about the ability of community health centers to adapt to emerging social and public health issues and the importance of community health centers within our health and social service system?
Sure. So I think I want to talk about community health centers, but we are also more broadly just a community organization. And we were really fortunate to work with other community organizations throughout the pandemic. And we also saw here in Saskatoon, we saw other local organizations really take the lead in supporting their communities, which are all as well our shared communities, and getting vaccinated and receiving care. And I think it's because we are sort of very close often to what's going on in people's lives. So we might be the agency that they check in with on a weekly or a monthly basis. In any case, we might be the folks that have the trust or the relationship built. And so we are right there. We're not stepping in newly to say like, hey, come out to, this large, like we use the exhibition grounds, which is this huge, like warehouse looking thing for a lot of our vaccines. But when we're able to offer them, hyper locally within the community that folks are already a part of, I think that really changes the game. And when it's an organization that they trust, I think, like I said earlier, it just means it's that much less of a barrier between they're right here and we're here with you. So I think that role, like the community health centers and community agencies more generally are the folks who walk with our community members as much as we're able and are able to support them through already built relationships.
Absolutely. That's perfect. Hayden, I want to thank you so much for taking the time to speak with me today. If anyone else
Absolutely.
wanted to learn about Switch and the work that you're doing, where would they go?
Sure. So we have a Facebook page for the Switch Clinic. We also have a website. I would say our Facebook page and our Instagram are sort of the dynamic, alive parts where you'll see what we're doing, who we're celebrating, and what's going on at the clinic. You're also always welcome to email us, so info@switchclinic.ca, or to me personally, and I can send you that email address. If you want to know more about, student-led clinics, student-run clinics, we're always happy to talk about that, because obviously that's part of where Switch's passion is in really being part of the student-led, student-run clinics across Canada.
Of course. I think the website is switchclinic.com, is it?
It should be switchclinic.com or switchclinic.ca. It should be.
I looked earlier.
Yeah.
When I was doing my homework, I double checked earlier. Perfect.
Okay.
I want to thank you so much for taking the time to speak with me today. And congratulations on such an innovative and very cool method of getting people vaccinated in your community.
Thank you. And thanks so much for reaching out to talk.
Okay. Thank you for listening to Community Matters, a podcast from the Canadian Association of Community Health Centres. To learn more about our association and the important work of community health centres across Canada, go to www.cachc.ca.